Hello, my name is Ryan Eland and welcome to your infant CPR training course. In this video, we will demonstrate proper CPR techniques for infants. The following techniques are only intended to be used on children under the age of 1. We want you to walk away from these courses confident and knowledgeable. So, if anything is unclear, please pause and rewind the video, go over it again until you fully understand all of the concepts. So what exactly is CPR and why should you know about it?
The lack of oxygen-rich blood flowing throughout the body can cause organs to fail and can cause brain damage within minutes. CPR can help keep oxygenated blood flowing and vital organs working until more advanced medical help can arrive.
More often than not, an unconscious victim will not regain consciousness while receiving CPR. When you perform CPR, you are manually doing what the heart and the lungs can no longer do on their own. This is why it is so important to not give up or get discouraged if the victim remains unconscious. Let's get started on the training. The first step is to check the infant for responsiveness.
Infants are very responsive to stimulus to the feet. Gently tap the infant's foot several times and shout his or her name. Be loud, but do not shake or hurt the baby. Remember, you are trying to wake the baby up. If the baby doesn't respond, yell for help. If the infant is not breathing or is gasping, you should begin chest compressions. Let's look at these steps again. Tap the infant's foot and shout. Yell for help. Check for breathing.
If you are with somebody else and the baby remains unresponsive, you should immediately have the other person go call 911. If you are alone, immediately begin chest compressions. Chest compressions are an extremely important part of giving proper CPR. In order to give high-quality chest compressions, you need to remember these 3 things.
First, location. Draw an imaginary line between the nipples. The location is just below this line, in the middle of the chest. Second, depth. Compressions should be 1.5 inches, or about 1/3 of the chest thickness. It is crucial that your compressions go deep enough. Third, rate. The rate of compressions is 2 per second. Make sure to not speed up while performing compressions. Going too fast will greatly reduce effectiveness. Gently lay the infant on a hard surface. Then put 2 fingers on the middle of the chest just below the line between the nipples. Now, push straight down 1.5 inches or about 1/3 of the thickness of the baby's chest. The chest should rise all the way back up before you push down again. An infant's chest is small, so make sure that you are not pushing on the belly or the upper chest. Please take note of the demonstration for the exact location and the proper hand position. Do 30 compressions at a rate of 2 compressions per second while counting out loud.
Compressions serve to manually pump the heart. Remember to count out loud as you do your compressions so that you don't lose track. Let's watch this one more time.
Carefully place the infant on his or her back on a hard surface. Find the middle of the chest, just below the line between the nipples. Push down 1.5 inches, making sure the chest rises all the way up before pushing down again. Perform 30 compressions at a rate of 2 per second.
After you have completed 30 high-quality chest compressions, it is time to give 2 rescue breaths. Rescue breaths serve to fill the lungs with oxygen so that the chest compressions send oxygenated blood to the vital organs, especially to the brain.
Put one hand on the forehead and gently tilt the head back, while raising the chin with the fingers of your other hand. Make sure to not have your hands on the infant's neck, or you will run the risk of blocking the airway. Next, cover the baby's entire mouth and nose with your mouth, creating a seal. Give a gentle breath for 1 second, watching to make sure that the chest rises. It is important to not breathe too hard. Let the air escape, the chest will go back down, then give one more breath. It is very important that you actually see the chest rise with every breath. If the chest doesn't rise, then the air is not getting into the lungs. In this case, readjust the head and give another breath. Let's look at this again. Gently tilt the baby's head back, opening the airway. Cover the baby's mouth and nose with your mouth, creating a seal. Give 2 breaths for 1 second each. If the chest doesn't rise, reposition the head and try again.
If you are by yourself, you will need to continue giving 30 compressions and 2 breaths for about 2 minutes. This is equivalent to 5 sets of 30 compressions and 2 breaths.
After the 5 sets, you should call 911. Then, continue giving CPR until help arrives or the infant regains consciousness. You can take the infant with you to the phone if needed. As always, if another person comes along while you are giving CPR, have this person immediately call 911.
Okay, now let's review the entire process.
Check for responsiveness by tapping and shouting. If the infant remains unresponsive and you are not alone, have the other person call 911, then immediately begin chest compressions. If you are alone, begin CPR. Carefully place the baby on its back on a hard surface. Place your fingers on the middle of the chest, slightly below the line between the nipples, and press down 1.5 inches. Give 30 compressions at a rate of 2 per second, making sure that the chest rises back up after each compression. Place your mouth around the nose and mouth of the infant, creating a seal. Give 2 gentle breaths for 1 second each, letting the chest fall after each breath. Repeat the cycle of 30 compressions and 2 breaths 5 times. If you are alone, go call 911. After calling 911, continue giving CPR until help arrives or the infant regains consciousness.
The main things to remember with infant CPR are the following. Number 1, be calm and assertive. Number 2, getting advanced medical help on the scene is always a priority. Number 3, give high-quality chest compressions by pushing 1.5 inches deep at a rate of 2 per second, watching to make sure that the chest rises all the way back up after each compression. And finally, give high-quality rescue breaths by creating a seal and watching to make sure that the chest rises and falls after each breath. Thank you for watching the infant CPR training videos. It is crucial that you study the written curriculum along with the videos. We recommend that if anything is unclear, you go back and re-watch the videos until you know all of these techniques by heart. Thanks again for choosing infantcpr.com for your CPR training.